RIN TV coverage of the 2015 European Insurance Forum is brought to you by the Dublin International Insurance and Management Association. Science is having a positive impact on our longevity, assuming you want to live longer, of course. But how does it impact on insurance? We spoke with Dr. Aubrey de Grey about the latest in regenerative medicine and what longer life expectancy means to the insurance industry. He is a biomedical gerontologist and Chief Science Officer at the SENS Research Foundation. A fascinating discussion. Here are the highlights.
Well, we have to be a bit careful with the term regenerative medicine because its conventional definition is rather narrower than it really ought to be. Conventionally, regenerative medicine means stem cell therapies and tissue engineering, the creation of artificial organs. But really, regenerative medicine morally includes everything that consists of repairing the molecular and cellular structure of the body. And in some cases, that means down at the subcellular level, inside cells, or the material between our cells. So I would say that regenerative medicine includes all of those things. Developments in regenerative medicine are happening all the time. Stem cell research is the most advanced area within regenerative medicine, and many areas of stem cell research at this point are now in clinical trials. For example, trials to treat macular degeneration or Parkinson's disease. Also, of course, many conditions that do not have to do with old age, but those are two conspicuous ones that do. There are other areas of regenerative medicine, especially the ones that SENS Research Foundation works on, which are at a much earlier stage of development, and the research is still happening in cell culture in a dish or in mice, for example, but still progress is very encouraging, and I'm hopeful that those areas will also come to clinical fruition within the next decade or two. The thing about regenerative medicine is because it repairs damage rather than simply slowing down the accumulation of damage the way that people who work on aging have been trying to do in the past, it has the ability to buy us time. Essentially, if you take someone who's already in middle age and you slow down their subsequent aging, you don't really give them very much delay in the time that they will have before they start to get sick. But if you take someone who's middle-aged and you repair the damage that's been accumulating in their body throughout their lives, then you genuinely rejuvenate them. You put them back to a younger biological age. And that means it will be a very long time before they're biologically middle-aged again. So the impact on longevity could be very much more dramatic. I think the main thing we have to remember if we ask about the societal consequences of these kinds of medicines is that mainly they will be applied to people who would otherwise be suffering the diseases and disabilities of old age. Now, those diseases and disabilities currently occupy perhaps 90% of the medical expenditure, the medical care that is undertaken in the industrialized world. And really, you can say that it also consists of 90%, or at least 80%, I'd say, of the suffering in the world. So it's a very big deal. And from my perspective, I would say that the number one thing that we need to focus on in terms of the societal implications is simply the fact that we won't have people with Alzheimer's disease. We won't have people with heart disease, or most cancers, or osteoporosis, or all the other things that go wrong with people who were born a long time ago. Now, the longevity consequence, the longevity side effect, if you like, of keeping people healthy is likely to be quite substantial, and that is in turn likely to motivate certain societal changes in terms of the structure of society, what we do with pensions, what we do with all manner of things. But really those are relatively minor aspects of the situation when compared to the issue of not having people being sick anymore. The insurance industry is certainly one area which will be substantially affected by the introduction of ways to keep people youthful however long they live, and in particular by the longevity consequences of that youth. First of all, we will have a situation in which the risk of death in the next year, shall we say, no longer goes up with age. Of course, these days it goes up by perhaps 10% with each year that someone gets older. That won't be true anymore, and that will have consequences for pricing of life insurance and also, of course, for other areas where we're talking about longevity, like pension plans and so on. But I don't really think that the disruption will be terminal. I think the industry will survive, because ultimately all that's really necessary is for the experts in the industry to anticipate and understand the changes that are coming and to develop and price their products accordingly.
For more of our coverage of the 2015 European Insurance Forum, visit the DEMA website or the special 2015 EIF channel in the RIN TV On Demand library.